Hello everyone, this is our masterclass about Botox and fillers, and a masterclass about Botox and fillers comes very natural to me because this is how I started my career in aesthetics. So I started out as an orthopedic doctor, as you all know, and when it was like beginning of 2001, I started injecting Botox and fillers, and I was very intrigued because nobody was doing it at the time. And I went to everyone. I went to the Curathers in Vancouver. I learned from the best doctors, DiMaio, how to inject Botox and fillers, and I created my very own technique in injecting. And what I always loved is to keep the face young and natural, and young not in a way that you don't want to have any wrinkles, but the structure. So instead of filling in all the wrinkles, I wanted to restructure the face and keep it really back, the structures in the right place, in the younger form. And so I never, even though I've been doing it 20 years now, I never went to do these days. There were all these crazy trends like these apple cheeks and big lips, and I never did that, you know. Also this crazy injecting Botox around the eyes, which changes your whole mimic. Those Botox faces was never my cup of tea. So, you know, my whole technique was really around bringing like the structures back, like young structures back to people's faces without changing their face. So people look just refreshed, and, you know, people would say, oh, were you on a long vacation? You look so rested, but not like, oh, what has she done, you know? And I think this was very important to me, always this natural look, the same like what I do with my skincare. I'm always focusing on natural use. And, you know, when I started injecting Botox and fillers, I came from the science background in the orthopedics, and I helped pioneering the treatment where you take the blood from the patient and re-inject it into the joints and create these anti-inflammatory proteins to take down aging in the joints. Re-inject it into the knees and shoulders, knuckles, and, you know, we just did all joints with this treatment. And I translated this knowledge into the skin, and I started mixing the hyaluronic serum together with the blood from the patient with these anti-inflammatory proteins. And I started this trend of the blood facial in 2002. This was the first time where I injected my best friend with the blood, and it was really groundbreaking because I did a lot of case studies where I injected half the side of the face together with the blood and the other half just with the hyaluronic acid, and you could see this immense difference, first of all in instant results, but second of all also in the lasting of the fillers. So it was really great to do those case reports and studies. I did a lot of you know, clinical trials around it, not like trials because they're crazy expensive, but I did a lot of you know, case reports of like 20 patients looking into what was happening. And also, you know, on the bottom of that, I also created the cream with the body-owned proteins. And this is how I got into skincare, actually. And from treating like, I don't know, 30 patients a day, now I'm more focusing on the skincare. I'm still seeing patients once in a while, definitely, and I love doing it, but I did it for so many years, and now everybody knows me as doing skincare, but I was really known as the doctor who was injecting Botox and fillers. So I know a lot, and I brought my friend and colleague, Dr. Estefania Lang, who's working with me and is taking over my clinic in Düsseldorf and seeing all my patients there. And she not only is a fantastic doctor, she's a dermatologist, but she's also started a super cool company, and it's called Dermatologin, and they are teaching young doctors how to inject Botox and fillers. And I thought nobody better than her bringing to this masterclass, because I know there are so many questions of you guys, and we want to do the best possible job to explain and educate you on Botox and fillers as best as possible. Estefania, thank you so much for joining today. I know it's a little later for you in Europe, but thank you so much.
Thank you,
Are
Barbara,
you there?
for the invitation. I'm super happy to be here. And I am also super happy to work for you at the headquarters space in Düsseldorf, Königsallee.
And you're doing such a fantastic, such a fantastic job. My patients love her. Obviously, she's beautiful, but she is also a beautiful soul and is the sweetest. So my whole entire team adopted her, and you know, I'm so glad that someone is taking over my patients who are all love so much.
Thank you, but anyway, they miss you a lot. But the good thing is that when I will talk about how I began at your headspace. I learned, the very first thing I learned was to keep patients natural. So it's a super demanded treatment, which is this non-invasive treatment with fillers and botulinum toxin. So I'm super happy to join this masterclass because we would love to explain in a super easy way the most important aspects of the treatment with botulinum toxin and hyaluronic acid as a filler. Because there are so many different injection techniques, and I was super happy to get your techniques, Barbara, in the past. I mean, when the treatment of botulinum toxin was new, there was a tendency to inject in a way that the face muscles were completely paralyzed, and the disadvantage is that the facial expression gets lost. And this is why
not just that, yeah, not just that, but also, you know, Estefania, would, you know, a lot, and that's why it's important to talk about this right now. I think what many doctors do, they follow like really old schemes, and you know, the way we do it, for example, we lift the eyebrow instead of pressing it down. So lots of techniques go and press your muscle down and this one up, and then you get this devil look. And I think lots of doctors just do it this way because, you know, they don't really, I think it's just a scheme which gets educated on all the time. They all do it the same. And I think, you know, the way I came up with the treatment where I block the whole corrugator, this is the muscle in our eyebrows, and this muscle is so important to block completely because it not just blocks the frown lines, but also lifts your whole eyebrow and not just the outside corner, which makes us look crazy. So I think it's really important, if you guys come out of this class and you understand where we have to pay attention, you can also direct the doctor you're seeing and say, you know, I don't want it like this, can you do it like this maybe? Right?
Yes. I think it's also super important at this point to define the terminology of Botox. The popularly called Botox is usually used to define the procedure with botulinum toxin, but the term Botox, in fact, is only a registered name of a pharmaceutical company. And there are also other good preparations on the market. You know, there are a lot of botulinum toxin preparations, and we have in fact lots of preparations in the past and in the present in Düsseldorf, and that has been always amazing to understand that it's not only a thing of aesthetic medicine, because you can use botulinum toxin also for chronic migraine, spasticity, incontinence, and hyperhidrosis, and.
Spastics, so, neck pain, esophagus spastics. I think it's been used in for so many more indications, and the dosage of the Botox in these other indications, they're so much higher than what we use in our face. And I think that's one point we want to clarify, because lots of people say, oh, Botox is a poison and we maybe shouldn't use it. We are so, you know, you know, would want everything organic and clean. And with Botox, it's been used for so many real diseases, like for kids, for esophagus spastics, they use a lot, or bladder incontinence. Yeah, I think it's just like used in a lot of higher concentration, and we for the face use just tiny bits of concentrations. And maybe you want to say something about the toxicity. Of course it's a toxin, but does it really go into our system? Does it harm us? I mean, it's been used for 40, 50 years now.
Yes. And I mean, there are lots of indications in aesthetics. There are authorized indications for the wrinkles in different anatomic regions, like the glabella, frown lines. I can do it quite very well now. And also lateral corner of the eye, and also the forehead. So these are super well studied anatomical regions, and the products are also authorized for these regions. Nevertheless, there are other regions that can be also injected as an off-label modus. That means that the drug is used outside of the authorized indication. However, there are a huge amount of studies and case reports and reviews that show that this application for this other regions is safe. So when I started working for you, Barbara, I was also very impressed that you actually inject a lot of lower face indications, because this is very risky sometimes, because these muscles are so tiny. Perhaps we can have a look to them in our presentation now or afterwards. But you have to know exactly.
Michael, the chin.
Yes, yes, it's chin. This is a very good. Yes, this is perfect, because we see there that we have many muscles that are really going together, and the dose that we need for this anatomical regions is really, really less in comparison to the ones in the upper face, forehead and corrugator, frown lines and lateral corner of the eye. So this is why, thank you so much, Michael. This is why it's important for the patients to go to a medical doctor, or I mean, in United States, it's also allowed
by
nurses and other professionals. So it's super important to have an anatomical schooling, and this is what we try to show and to teach in our online courses of Dermatolog. And I'm super glad that we have done now many on-site courses in your headquarter in Düsseldorf, trying to understand, trying to explain that this is super important, that we can't just, you know, like relax the muscles of the upper face and ignore the lower face.
And I think it's really important to, first of all, in Germany, only doctors are allowed to give Botox. And we're talking about Botox right now. So because many people ask, what's the difference between Botox and fillers? And with Botox, for example, that's why we're talking about the muscles. Botox is only injected in the muscle, because what Botox does, it suppresses the contraction by blocking the neuron on the, was heißt motorische Endplatte? On the muscle. So it's really important to understand that Botox is only being used to stop expression in the face. It's not, a filler is something which fills in material in a sunken in situation or in a wrinkle, but a Botox is really just there to block the muscle and that the muscle doesn't do contraction anymore. And that's what we want in the frown line, for example. We don't want to have the sagging of our corners of our mouth. We don't want to have the platysma, the neck muscles so strong. So we want to work against those movements, or lots of people, I actually don't do that, inject, lots of doctors inject around the eyes, which really changes the expression in your face. So we address certain muscles in our face, which with the time of aging becomes too prominent. So when we are kids, we don't have this prominence of these muscles, but when we are older, we use them a lot and we train these muscles and they become overpowered, and then we want to just keep them a little more relaxed. For example, if you have frown lines, and people, when they get older, they notice that, you know, your eyebrow comes lower and therefore you get droopy eyes. And that's because the corrugator, the muscle on your eyebrow, becomes stronger, stronger, and stronger. And then some people notice if it's uneven, the strength of the muscle, then one eyebrow is higher than the other one. So you could inject in this corrugator muscle, in this eyebrow muscle, the Botox, and then this muscle relaxes. First of all, it lifts your eyes, but also lifts your eyebrow. So it becomes really, and I did Botox myself so you can see it. So I can't look angry, but I still, you see, I can really move my eyebrows up, because lots of doctors just block here and then you can't lift your eyebrow, and it's low like this, and then you have like this Mephisto eye, which you don't want. So it's really important to tell your doctor they should block the corrugator, the eyebrow muscle, in order to have this lift. Yeah. And this is Botox. Botox is really only for the muscles. Fillers is something else. Fillers, hyaluronic acid, and fillers we inject in places where we want to have volume. Like, you know, in modern days, you know, when I started, people like to fill in wrinkles, which was kind of, you know, how it was in these days. They injected the nasolabial fold, they injected even here in the frown muscles, they injected here. So this was the time when I started. Now where we inject fillers is in areas like here and here to lift, or in front of the ear to lift this back out of the face. So I almost never inject a nasolabial fold because they lift out of the face, which is so much better. So you do like a whole you know, basically a whole area of filler, not just like a wrinkle or some tiny drop somewhere. So you do, I really go high up in the hairline, and Estefania did it on me before I left Germany, and did some here, because we use cannulas as well. So you go in with cannulas, you do like a tiny little hole. It's really non-invasive at all. Go into the face with the cannula, and you inject fillers, like, you know, like whole areas you inject to really juvenize these areas and make them also pull, you know, everything which is hanging here up again. So that's the very modern way of injecting fillers. Just for people just don't understand what's the Botox, what's the difference between Botox and fillers, but it's really two different you know, techniques and indications.
Yes, I would like to add that this cannula, which is stumpf,
blunt.
Yes,
it's a blunt.
It's blunt. We at the beginning we make a little stitch with a normal cannula, which is spitz. Oh my god.
Yeah, it's like a sharp needle. So you do like a little hole in the skin with a sharp needle, and then you stick in the cannula, which is blunt, and then it doesn't destroy the tissue underneath. So it's very non-invasive in a way.
This is super important because a few years ago it was not that common that every injector was doing it like this. But this is super important because the risk of having an intramuscular injection, meaning that an artery or a vein has been harmed, is less. So it's super less risk when you go through it with this cannula and you do it like slowly. Aspirating, so it's nothing.
Aspirating means you pull the needle back and you see if you're in a vessel, and then you would see blood. So we check first if we're near a little vein or something, so you can just inject the material without destroying the vein. So it's you won't get bruises from it. So it's like, you know, normally, you know, you come in your lunch break, you get it done, you don't even see that anything is done, because it's so less invasive and you just get the result right away. And you know, when I started, or doctors still today use a lot of sharp needles, which is totally unnecessary, and they cause swelling and bruising, and you can't get out of the house for 2 weeks. It's crazy. Yeah. So I think it's really important to go the minimal invasive way. And yeah, that's what we're doing. Estefania is a total pro. She's so good. She's touching my face. So someone is asking, how often would you recommend Botox? But would Botox or fillers work for slight wrinkles under the eyes? That's a very good question, because under the eye area often gets a lot of wrinkles. And I tell you one thing, if you get Botox in your eye area, let's see, for example, you're like 25 and you notice like these, you know, tiny wrinkles coming up here. Number one, this can come from totally dehydration. So I would always start to do the right skincare first to hydrate your skin, because they can go away by themselves if you really hydrate them well enough. Second of all, don't get Botox here, because if you get Botox here, so they block your muscles around the eyes. And then what happens, do you see that, Estefania? I will demonstrate. So you block it and then you smile, and then everything comes here. Everything gets stuck under your eyes, because this can't move up anymore. And then what happens, you get a lot of under eyes wrinkles from having Botox. So sometimes if a doctor is not careful and they do the wrong things, then from just fixing a part here, you cause a lot of problems under the eyes. So if you have wrinkles under the eyes, I would always start with the right skincare, with the right products. For example, using the super anti-aging serum, the night serum, and the eye cream. You know, really hydrate, and never use Botox under the eyes. Never under the eyes, never around the eyes. That's my recommendation. If you find yourself having wrinkles around your eyes, you can go in with a light skin booster, with a really light fillers, with a cannula, with a blunt cannula. You go do a little hole from here, you go underneath the skin, stay very close to the bone. It sounds horrible, but it's very not a problem. And you add a little filler under the eyes and around your eyes with skin boosters, meaning like very, very light hyaluronic acid. You can also combine it with your blood. It's really, really great. And this will support hydration underneath, and will do like a very, very careful filling in these areas, because these areas, the skin is so thin there. If you go in with a too thick of material, you know, remember, hyaluronic acid binds 1,000 times its weight on water. So if you put a filler under your eyes and then it sucks in all the water, if you have like a high netted filler which is too thick and you put it there, it sucks in all the water. You know, lots of people have these little worms under their eyes, and that's because it's injected too high up. It's a wrong filler, and that's what it does then. And lots of inexperienced doctors, but also, you know, nurses or whoever does it, it's really an area where you need to be really careful and go to an absolute expert. Yeah, don't just go because it's cheap. You really need to have someone who knows what they're doing.
So we are performing it, for example, with the long cannula. We have 8 centimeters. We go from the cheek into the deep area just over the bone. That means under the muscle, applying there super softly the whole filler, the hyaluronic acid. And you can turn a little bit to the lateral angle and fill in there a little bit. And what we always recommend is to start for the very first time doing it soft. It's better to come another time, 4 weeks afterwards, and give a little bit more. But once the eye gets swollen as a complication, the under eye area, it's too late. So this is why it should be always performed by an experienced injector. So this is super,
That's
super
really,
important.
that's,
I had once Botox, botulinum toxin, in my under eye because I was a little bit rid of the wrinkles just at the beginning when I didn't know how.
what happened?
Yes, and in my case, the muscle was so relaxed because I was so young. The muscle was so relaxed that it doesn't. I was looking like unemotional. I couldn't laugh. It was weird. I wouldn't do it. So I'm really explaining all patients completely what this means, because once it's there, Botox is working 48 hours after injection and lasts something about 3 months. You can't do anything else to stop this when it acts.
When it's done, it's done. It's
Yes.
it's really, and this is another thing you just said. So we take a lot of time for a patient. So lots
Yes.
of offices, you just go in, you go in the waiting area, you sign something, you go in a chair and someone comes. And I also saw that sometimes they have like injectables where they have 1, 2, 3, 4 needles in one, they go in like, and it's crazy. Every face is different. Every structure is different. The anatomy of people's faces are different. Of course, they have a similar scheme, but you have to look at a person's face and have to study it, and you have to evaluate what does the patient even want? Do we want the same thing? Does the patient want something different than what I think is right for him? Also, if a patient says, oh, I want this and that, we say, I wouldn't recommend it. And if they anyway want to do it, they need to go somewhere else. So we only put our signature under something we really stand for, and we only recommend the things we think is right for this patient. And I get questions asked here as well. You guys asked, you know, should we start doing Botox in our 20s as prevention? And I don't know if Estefania has a different take on that, but what I would say, because I started Botox when I was 30, because I was like you know, you inject into people's faces and you want to try everything on yourself. So of course I injected Botox, and I did fillers, and I did my lips and everything. And what I noticed, because I started when I was 30, what I notice now, if I don't have Botox injections, my eyebrows are super low, my whole muscles atrophied on my forehead. So if I always need to have Botox, because otherwise, you know, I don't like it, you know. And I think you should wait as long as possible. Don't use Botox as a prevention. Only use Botox when it's really something you need. And you know, and I have lots of patients who come to me, and also I have lots of young patients, and they say, oh, can I have Botox? I said, no, you wait. So of course, some people in their 20s already have a strong frown line because it's genetics and they move a lot. And yes, then there's an indication. Or people have, like, you know, genetically really hollow eyes. Yes, there is an indication. Or people have like strong biting muscles and have bruxism. Yes, there's an indication. But to do Botox as prevention, I would totally recommend against. Also, you know, as I just said, around the eyes, if you have fine lines around the eyes, do your hyaluronic serum, do your super anti-aging serum, do your night serum and your eye cream. You will be fine. You know, it's really something you can really in early ages take care of, the right skincare, which I didn't have when I was in this age, because I was desperate to find a good cream. That's why I started these products, because there was nothing on the market. Now there is, so you have all the opportunities to help to prevent from wrinkles. Also, if you see those fine lines appearing, you have the lifting serum now. We created the lifting serum. It's the most genius serum, which, because people also ask what can replace Botox, and it's definitely not a replacement of Botox. But what it does, you use this lifting serum after your face cream, after your moisturizer, and it creates, and I show you how it works. You take a full pipette, it creates matrix of biopolymers on your skin, and it really helps to lift your skin. And you know, my friend the beauty sandwich told me he uses it for, and it's really great, Estefania, here for this. And you go really all the way behind, and for your neck, and everywhere where you have wrinkles, around your eyes, around your mouth, on your forehead. Use the lifting serum to, especially now during quarantine, you know, to help with wrinkles and fine lines. And it not just lifts, it also fills in the wrinkles and fine line. And here on this jawline, which is you know, Estefania is still young and beautiful, but you know, when you come in my age, Estefania, you will really admire this lifting serum. You really put it really behind your ears. This is such a great product. So guys, no Botox as prevention. Estefania, what do you think about that? I don't know what you think.
I totally agree. I totally agree. I have some patients that, for example, ask me to do this treatment with botulinum toxin, especially in the summer months or after summer, because when you try to look with this sun shining, it's more pronounced that you use the muscles. So when someone is really like, please, 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 I say, if I would do it, then in the late 20s and with the half dosage, yes.
Yeah.
But not, you know, with a good hyaluronic acid serum and a good face cream hydration. It can be better for this really superficial wrinkles. But if you're beginning with Botox, just wait for 30. This is better.
Another thing is, you know, I totally agree. If you're going on a summer vacation and you want to inject Botox, because as you just said, when you look against the sun, you just do this and then they become really prominent, those wrinkles. What you have to pay attention to, if you do it like 2 days before you go in the sun, don't go in the sun with it, because you just, with the injection, you create like a micro injury in your skin. And if you're not careful and you go with that into the sun and you don't have the right sunscreen, whatever, it can cause hyperpigmentation in the areas where you inject the Botox. So for example, I did some Botox injection here and I have a hyperpigmentation spot just because I wasn't careful enough. So it's really important when you get Botox injection that you do it, you know, don't go in the sun right after. Wait a couple of days until it's healed up again. Use sunscreen. Really important.
Sunscreen is so important because of the UVA rays who are responsible for the aging. So this is the best prevention. Since we are born and in poverty and afterwards. So you should use every time, every day, UVA and UVB protection. And I have one Ausnahme, exception, with the bruxism. So when patients have or bruxism is when is an excessive teeth grinding or jaw clenching. So doing the treatment with botulinum toxin helps so that the patient stops grinding. And
they don't stop grinding actually, because you know I've been doing this. I did a study on that. I've been doing this forever, this Botox in the jars, because you know, especially at night, you know, and right now everyone is stressed because of the corona thing, you know, and then you put all your stress on your teeth through this muscle, which is the strongest muscle in our body, and it makes our teeth crack, and it makes our you know, gives us headaches and pain in the neck. And if you can you know, relax the muscle with Botox, you don't stop grinding. Actually, you still do it, but the power on your teeth is not there anymore, you know.
Of course. So this is an indication that I would say, okay, this is independent of the.
I do it for Charlie. I'm injecting. That's the only place where I inject Botox or anything into Charlie. Are the masseter muscles.
Yes. This is super important, and this doesn't modify the facial expression.
No.
It has an effect of slimming. This is the thing. There are people with a really big masseter muscles. So this is a good indication for it.
What do you think about a brow lift? Someone is asking, and that's a really good question. And I hope I explained it a little bit, because, you know, as I said, when we get older and this muscle becomes stronger, the brow goes down automatically. What I would try with you first is injecting the corrugator and see if we can do a brow lift with Botox, because that's really perfect and it's working. It's great indication also for men. And I would try that first before I do surgery. I think the trend is really going away from surgery and doing like more natural types of filling and Botox. You can also use filler here in your hairline and you lift your eyebrow with that. So by the way, someone is asking when we open Düsseldorf. You're doing treatments right now, no? You're in Düsseldorf.
Yes, we have opened.
Good. So you just can call the Düsseldorf office and Estefania is there.
Yes. This what you talked about the chemical eyebrow lift, and this is completely on vogue now. There is also a treatment with threads, and this is also what we're doing in Düsseldorf. So this is also a natural way to do it without performing surgery.
Yeah, the threads, I love the threads. I actually need some, Estefania.
Yes,
it's really great. The threads are so great because, you know, this is like surgical threads. You place them, you know, you do 3 here, 2 here. It gives a nice lift, and it helps to firm the skin, but it releases the thread into the skin. It will dissolve after 8 weeks, and it makes your fibroblast grow round, and it really gives you a nice little tack back. And it's a really great way, and it's not really invasive, so that's why we like it. And there are not really any side effects, and unless you do it wrong, but it's very easy treatment. No?
Yes. So I think what's also a super important thing is the good documentation for the follow-up. You mentioned that we spend a lot of time for our patients, and this is super important because, for example, marking the injection points with the dose is essential, because if the patient is happy with the treatment, this treatment can be reproduced exactly the same way. And if the patient wishes more or less botulinum toxin or hyaluronic acid in the future, in the follow-up, 3 or 6 months later, it can be adjusted in the follow-up visits. So this is why I really recommend the patients to treat a doctor that documents everything.
Yes, very important. And lots of people ask, when should we start and which age? And it's really like that. We can also organize FaceTime consultations maybe with Estefania, if you guys want, because you really need to study the face. Not everyone is the same. Not, you know, every genetics is the same. So it's hard to say, oh, you should start when you're 30 or 35 or 40. Some people, they can wait until 45 until they have their first Botox just because of their genetics. And I would never recommend for anyone who doesn't need it to get it just to get it. So really, we make it individually depending on when to get fillers or Botox. And if you are around in Düsseldorf, make an appointment with us. We are really happy to help. Lots of questions about heavy eyelids with Botox. So the eyebrow lift, and that's important. Your doctor should not block this eyebrow to come down. The corrugator has to be injected, and there's another point right at the end of the corrugator to help the muscle which presses everything down here to lift it up here as well. So it's possible to do an eyebrow lift with Botox, and we do it a lot in the clinic. And then a question about sunscreen. Can you wear sunscreen without a moisturizer and right after serum? With our sunscreen, you can do that. It's an SPF50, and it's also a lipid serum, and you can use that. I always recommend to still use a moisturizer, even though it's the light moisturizer. We have a face cream light, and maybe you mix it with the sunscreen, with the sun drops, maybe better to do that. But you know, if you have super oily skin, maybe you want to just use the sunscreen. What do you think? Maybe better with an cream.
Yes. So best thing is applying sunscreen at the beginning, and if necessary, depending on skin type, then using a moisturizer, of course, regarding the skin type.
Yeah, I always recommend, because you know, with my products, they always dissolve into the skin, and I think with the sunscreen, it's super important that it really disappears into the skin to have the best results, and to have the protection. So it's really important that, you know, if you use skincare which sits on your face and doesn't really penetrate into the skin, then it's really a problem to put the sunscreen after. So the sunscreen always should be able to really penetrate into your skin. And that's why, you know, with my products, they all dissolve into the skin. So I always rather recommend to mix it in your moisturizer or use it after your moisturizer when you go in the sun. Should we have some people dialing in so that we can answer questions on one-on-one?
Yeah, so we should have someone waiting on the line. Andor is the first person.
Oh, look, there's one question. I've done Botox since I was 38 now. I'm 50, and as you have mentioned, the muscle atrophy is so much more obvious what to do. So the muscles atrophy because it's like, you know, if we don't train our biceps, it will atrophy as well. And same with these muscles. If you don't use them, they will atrophy. And of course, muscles also have like a, you know, it's like a tissue, and if it atrophies, it is missing out on the tissue, and it takes away from our, you know, how do you go, plumpness or youth. And that's why, you know, that's what I noticed on my forehead tremendously, you know, that, and I think I have to say, I think I noticed this in lots of areas of my face. I think I would personally, if I could change that again, I would never do Botox that much and that young that I did it, because of this atrophy of the muscles. So there are gadgets like the New Phase, for example. New Phase is a micro current machine, and I have started to use it. I haven't used it for long, but they claim that they can stimulate the muscle, which I think would reactivate the Botox, the muscle contraction too, but they say it doesn't affect the Botox effect, but it helps to stimulate your muscle to grow again. So I want to try it, and I will keep you posted on what's happening, but that's something we can try for sure. What do you think, Estefania?
Yes, I agree completely. So, in fact, I would start at the late 20s. And
oh, look this.
I see a lot of questions. It's always around this. So when do we start?
Yes, there's one question, Estefania, and I want us to talk to this together, because someone said, you're the only doctor I have heard speak about against retinol, vitamin C serums. No, I'm for enzyme peels, and I'm also not against microdermabrasion, but I'm against retinol. I'm against high dosage vitamin C serums, because vitamin C in high dosage, studies show that it you know, damages your skin barrier function, which is absolutely a problem. And when we use retinol, retinate causes inflammation and also disrupts our skin barrier function. And how our whole philosophy is around anti-inflammation and strong skin barrier function. That's why it doesn't fit into our philosophy. And I think there are studies being made right now about the usage of retinol, and I'm sure this trend will go away. And there's like, I think even natural retinol right now. I mean, there's like, it's just a problem if you really go into your healthy cycle. And if you have a problem like strong acne, or you have like really severe problems, then using you know, tretinoin or something stronger can make sense. Yeah.
Yes.
But to use it on an everyday base as an anti-aging tool, I don't know what is your take on that, Stefania?
I think it's as always in life about the dosage. You can do it like really low dose, but if you have a good skin barrier and you don't have like a severe acne, where of course I recommend daily isotretinoin, etc. I would you know, like recommend this philosophy of corneotherapy.
That you have to explain, because this is a new term in dermatology, and I'm sure I'm responsible for it, because that's what I've been talking forever, and it's so important, because when we age, the skin barrier gets loosened up, and that's when we have transepidermal water loss, which makes us age even more. And if we do it with self-inflicted damages like retin-A, that can cause problems. If you do it as an acne treatment for a certain amount of time and then you go back to strengthen your skin barrier function, fine, but to use it as an anti-aging tool is not the right way.
Yes,
actually have someone waiting on the line, by the way.
Maybe a right way, but for skin types that are lasting it. Some skin types may have no problems with it, but sensitive skin types may get really fast red with
inflammation.
So you should, in every case, visit a dermatologist, a doctor before, who is specialist in these cases and in value.
Yes. So we have the first person waiting. Who is it? Andor?
Hey, how's it going?
Hi, how are you?
Good, how are you? Big fan. Started using your products in your product line back in April. Just freaking fantastic. And
your skin looks amazing, by the way.
It's the Sturm glow. I can't, and actually just got Botox too. I got Botox last week, and I feel bad because I did both things that you told us not to do. One, I'm 35. I have very slight wrinkles here and under the eyes, so I got it preventative. This is like the 4th time I've gotten it. And I've also got it here. So I'm just like, oh no. But
why don't
shame
you
on me.
Love?
What's that?
Can you smile? Smile. Do you feel like your smile is still the same?
I do. Because I don't feel like it's hunkering down or anything, and it still has some movement.
No, it looks good.
So
yeah,
yeah, and then, no, so.
No, you go ahead.
No, I just didn't feel like I ever got heavy, and I still wanted some movement and everything. I just had very fine wrinkles here and underneath the eye.
If you do like very superficial and very low dosage, you know, you can do it because it addresses not the deep muscles, it addresses more like the little fibers on top. So that's fine. And I think I don't know you from before, but it looks good.
All right, thank you, appreciate it. My question was, what do you recommend? I don't know if you're a fan of the gua sha stone, but how does that play if you get Botox? Is that something that you shouldn't do when you get Botox, or? And it's like that little stone that you basically use to massage your face and everything. So I don't know how that would play.
I think you should use that because all this massaging promotes your fibroblast, promotes your collagen growth, your growth factors. I think it's really nice to do massaging of your face. Not too crazy, obviously, but it's really good to keep your tissue engaged, you know, and I think that's what we need. Especially when we age. Also our facial scrub, for example, it's a really great way to massage.
It's amazing. Yeah, Enzyme cleanser, yeah. I'm all for it. The powder, it's freaking amazing, yeah.
So it's just nice, yeah.
I would perhaps made an exception the first 2 or 3 days until the toxin acts, so that you don't so that the toxin doesn't move.
Yeah. You just get all like,
But it's a week ago. It's fine now, huh?
Yes.
Yeah, it's been a week.
Now it's not a problem, yes.
Yeah.
Fine.
Okay, great. Awesome. Thank you so much. Appreciate it.
Good to see you. Keep up this good skin.
And keep up with the great products. Thank you. Love these.
Thank you. Mwah.
Next you have Sharon.
Sharon. Hi, Sharon.
Hi,
Hi.
I'm Celine from Germany, also a big fan of you.
We're in
And
Germany. We're in Germany.
Hanover,
Hanover. Okay, cool.
you know. Yeah, I'm 25 and I'm starting to get a frown line here, especially in summer.
Yes.
And it's really bothering me because it started to stay, so it's not going away for a few hours, and I look really angry with it, even if I'm not. So
You see,
yeah,
that's genetically predispositioned, you know. So if the wrinkle already stays there, then the easiest thing is, but then don't do your whole forehead. Really just only do the frown line, just a little bit, you know, maybe 3, 4, 5 points. Done. You know, don't overdo it. And in this case, I also wouldn't do filler. I would do a little Botox. Maybe also start with half dosage. Estefania, what do you think?
Come to Düsseldorf. So
Yeah.
I will.
Yeah, come see Estefania.
yes,
Okay.
I'm happy to see you soon.
All right, thank you so much.
Good to see you.
Yeah, good to see you both. Thank you.
Bye
Hi.
bye.
Hello.
Hi.
Hello.
How you guys doing?
Good. How are you?
Living the dream one day at a time. My question is, well, first of all, I started using your products whenever I was 23, and I had like these deep set lines from college and staying up late and drinking and everything. And then I'm 25 now, so it's been 2 years, and it literally erased anything. I don't have,
You see?
and it's crazy, honestly.
I love it. Love it.
Thank you so much for that. But my question is, what is differences in Botox fillers in the terms of men's anatomy versus women's? I hear there's a few differences. I just wanted to get both of your opinions, because it's very different here than it is, I think, in America, and how they push it in America. So,
Estefania, you want to do that? Should we show some pictures?
Yes, we could show Michael the picture with the maceta there, where you see here. No, one more. Okay.
Oh yeah.
Yes. So this is one of our anatomy pictures of the dermatolog in online Botox course. And you see that the masseter, this muscle, is normally in men very, very, very strong. So this would be, for example, one of the differences, that we can apply a little bit more in men than in women. Of course, depending on every individual, on every patient. But this is, for example, one of the points to have into account. But also we have to ask men when doing Botox. This is the term that is often used. What men would like to look like afterwards?
Yeah.
What's the desire? Do you want to have, you know, like a relaxed appearance with a little bit of wrinkles, but not that accentuated? Or do you want to have completely everything without wrinkles? And this is why we can, when applying botulinum toxin, do correction factors, you know, like we apply a little bit more or a little bit less, depending on what the patient wants to have.
Also, Estefania, I think, you know, with men, they don't have the curved eyebrows. They have like straight eyebrows. And, you know, often if, you know, men get blocked their forehead muscles, the eyebrows come even lower. So that's often the problem. So I try to stay away or be very careful with the forehead with guys. I also, I block the corrugator to lift the eyebrows, but keeping it in the right shape, and do like a little eyebrow lift. But I really concentrate on getting, on not making their forehead too heavy. And I think, you know, yeah.
And we have to apply also a good amount at the lateral parts of the forehead, because otherwise happens what
it doesn't
Barbara
go up like this.
Spock eye or Mephisto eye, because these fibers are not getting relaxed, and then it stays a little bit strange. So,
but a very good question, Nick. It's really important. That's why we say it's so important to study the face, you know, and make you know, the desires, point out what do you want to look like, how do you you know, do you want to just have a little refreshed and relaxed? Do you want to change maybe a little bit your physiology? So it's really important to understand what the patient wants, and then it's really important to understand what's even possible, and you know, what expectations, because these days people have like the craziest expectations, you know, because we see on social media all these face-tuned pictures of people who really don't look like they used to look when they were younger, and it's not always, you know, even possible to do. Of course, a lot of things are possible, but I think it's really important to understand what is the desire and what's even possible. And, you know, some people really come with really wrong expectations, and this is what we as doctors have to manage.
yes.
Oh, very personal, it seems like, per patient.
Yes, yes, per patient. Thank you, Nick. Good to see you.
Well, both in
Happy
Germany.
weekend.
Yeah.
Yes. Thank
Bye.
you. Bye.
So now,
Good
we
questions,
have
by the
Sarah.
way.
Sarah. Sarah.
Hi.
Hi, Sarah.
Hi, it's so nice to meet you finally.
Hi, so nice to meet you. Welcome.
Thank you so much. I am joining you from Weymouth, Massachusetts, which is about 15 miles south of Boston.
Oh, nice.
Yeah.
Very nice. South of Boston.
South of Boston, yes.
Where's Cape Cod? Is this Cape Cod?
That's more south than me. It's about 40 miles.
And where's
south.
Martha's Vineyard?
That's an island off Cape Cod.
I know, but is it like close to you, or is it south?
It is. It's south. Yeah. It's.
Okay.
I would have to drive about an hour and a half to get to where the boat is to take me to Martha's Vineyard.
Okay. I got it. I know where you are now.
Well, my original question was, what were the main differences between Botox and fillers? Because I really didn't know a lot about fillers. I had very minimal information on Botox. I'm 37. I've never done either of them. So you kind of did answer my questions earlier. So, and I know you mentioned earlier that you shouldn't use them as prevention, but I didn't know, you know, 40 starting to loom. I didn't know if it was something I should start thinking about, or just kind of when I think it's needed.
So the light is not ideally to evaluate your face right now. No, but it's really important to understand. Is there anything regarding your muscle activities we need to change? Is your you know, if you're 37, you like this low? Bring your bring this low. Can you bring your corners of your mouth down? Just with your muscles, not with your hands. Don't use your hands, just with your muscles. Say E, E. Yeah, you see this muscle, it's called depressor anguli ori, and this is a muscle which pulls down your corners of your mouth. And this can be blocked very slightly in order to get this a little up again. So show me your frown lines, look angry. Yes, you see, and relax. So you hardly ever do that. So I would maybe do a little bit in the lower part of your face. I wouldn't start, because your eyebrows are really nicely high. I wouldn't start with that really. You know, if we smile again, do you have wrinkles around your eyes already? Yeah, you see, this is starting to happen. This is starting to happen, and that's a really interesting. Look to the side. Look out of the. Look to the side now. Look to the left. Yeah. So now what's happening? You know, the side of the face. When we age, this bone, the jawbone, gets less and less and less because of missing out on estrogen at some point, and you know, our skin is sagging forwards like that. So this is what happened. And this part becomes very gaunt, you know, this part. I'm not saying that you're just 37, it's all good. But when you come in my age, that's when it's happening. So this whole entire part becomes very atrophied and gone. So what I like to do, I really reshape this part here with fillers to make this part young again, but also get the lift back up, you know? So by losing this part, this all stacking forward. So if you want to know how we look when we age, you know, it's all coming a little forward. So we need to keep this all nicely in the back. And this is something you probably at one point want to start with, filling out this area here in the back. I don't see much of use at Botox in your face. Estefania, what do you think?
Yes, I fully agree. Looking super for 37, did you say?
Yeah.
Yes, thank you.
Yeah.
Thank you.
She looks great.
Thank you.
Good.
Good genetics.
Yeah. Also, please come to Düsseldorf if you ever travel to Europe again.
I would
if
love
you ever
to.
travel anywhere again.
I know. I think I would only trust the two of you to put anything in my face.
Yes, come and visit us in Düsseldorf. Düsseldorf is so nice. It's such a beautiful city.
I would love to. I've never been to Germany, so I would
I'm
love
sure there's
to come.
a direct flight from Boston. I'm sure. Not
Oh,
right
I'm
now,
sure.
definitely not. But you know, even if you fly into Frankfurt, it's 1 hour with the train from Frankfurt. Very easy.
Oh, okay.
Yeah.
I'll put it on my list of places to go.
Good. Perfect. We can't wait to have you.
Thank you so much. Thank you for this great webinar. It's amazing, all of these that you've been doing.
Oh, thank you so much. I'm really happy you guys enjoyed. Otherwise, no reason for me to do it. So maybe, you know, you guys can give a little bit feedback and on what you want to learn about and, you know, what you like about these classes, what you think we should do better. So let us know, okay?
I will. Thank you so much.
Nice to
Thank
see
you both. Bye.
Bye.
Thank you so much.
Bye.
Hi.
Next one.
Next we have Michelle.
Michelle. Next one. Hello, Michelle.
You guys see me okay?
Hi.
Yes, hi.
Hi, nice to meet you.
Good to meet you.
First of all, I'm a huge fan of your products. They literally saved my skin from dehydration for the longest time. So answer to my prayers. But I'm currently based in San Diego, California. So really dry over here. So again, your products have been a godsend. But my question was, I'm not only 25, but I'm 25. And I guess for me, I know the big question was about age and like, at what point should you start doing Botox and fillers? But I actually have a tendency to like grind my teeth a lot and just have a lot of jaw tension. And I think genetically I sort of have a rounder face to begin with, but I kind of wonder if that jaw tension is creating.
Can you bite for me, bite. Yeah, you see, if I would feel it right now, the muscle on your left side would be stronger than on the right side.
Yeah.
Is this your right on your?
Because I chew with my left side. Yeah.
Yes. But the actually the right side, this side of your face is bigger. You have a bigger. Yeah, it's asymmetric, which is all our faces are asymmetric.
Right.
Don't freak out. It's everyone. but it does have a little more structure on that side. Maybe it's also the light, but that's how I always see it. And definitely, if we would inject some Botox, which will help you, probably helping with, you know, headaches or tension in your neck, if you have that at all, because if you have this stress and grind your teeth, you normally really have problems, you know, with your tension here and headaches. So if you would put some Botox in here, it will just shrink the muscle, relax this power on your teeth, and help with, you know, imbalance, and also help probably a little bit with the asymmetry. Estefania, what do you think also about what should you do regarding anti-aging? I think you look like a baby. You're only 25. You're using the right products. Hydration is the key. don't start too early to do anything. I think you're, you know, from your genetics, you're just super, super young, and it's better to not mess with your face, you know. Wait. Maybe do the Botox for the masseter. Estefania, what would you recommend to do?
Yes, I would also say you have a super harmonic face, no loss of volume, no wrinkles. So don't start too early. You don't.
Yeah.
Yet.
Got it. Okay, so then doing a little bit Botox here is okay.
Yes,
even.
just
Okay.
in the muscle. I do this for my 24-year-old, and keep using the products. Hydration really is the key. And you know, if you want, start using maybe the night serum or the super anti-aging serum. You can also use the lifting serum. All these products are very safe to use for everyone who wants to do anti-aging in the right way.
Awesome. Amazing.
Okay.
Thank you so much.
Good to see you.
Thank you.
Bye. Bye. Who's next? Erica. Welcome, Erica.
Hello.
Hi.
Hi. So I had a question about lip fillers. And it's mainly because so far I haven't done anything to my face except for using your skincare. But I have really thin lips. And the biggest thing is I like the shape of my lips. And I just wouldn't want to, like, so it's like I'm too scared to mess with that, but I wouldn't mind having some more volume. Just wanted to know what your stance is on
this
fillers.
lips is very, very difficult, and you need to go and see a pro. It's really, really important because lots of doctors do a lot of filler even above the lip, and it looks horrendous, and you look like a duck. But you know, there are weird techniques how to put filler in the lip. What I do, you know, if I only want to create volume. How old are you?
I'm 29.
So you probably don't have to do like a kissing mouth. Do this. Yeah, so you have, except on the, it's hard to see in the slide, but except on the left, you have like a little indentation, but you don't have a lot of tissue loss here yet. So you really only need the filler in your lips. And the best way to create volume is, as a doctor, you pull this a little up, and then you go with the needle into, from the side into the lip, and create the volume here. And it's the most natural way. And you could do like a little here and a little here, so you have it even. And I think maybe just a little bit in the lower lip, but the up. Where do you live? Can you do?
I live in Colorado.
Oh, in Colorado. So
the light's better.
Yeah. So we need to find a doctor who can do it there, but you really need to come from here, put the needle through here, inject the volume, get out, next step here, and that's it. They cannot do anything more, and this will really just give you a nice one, because your shape is nice. It's really nice shape of your lip, and a little more volume would really get you a long way.
Yeah, I just think it could maybe balance out my face a little bit more, because it seems to kind of just go from like a triangle to a little point.
Yeah. Estefania, what do you think?
Yes, I think it's super important. This is what we try to teach to the medical doctors who, or to others who are performing it, that it's a super difference in the technique to achieve this, because you have to apply it really in a deep plane so that you perform an inversion of the lip, because this is what you want to reach, that the lip gets a little bit of volume, this of course also, but in fact you want to rotate a little bit the lip out so that you have, you know, like more red lip to see combined. So I would always ask for a certificate where you go in Colorado, someone who's really.
I have a better idea. Why doesn't she ask the doctor to watch your video?
This is also a great idea. We have an online platform where we have online courses for doctors and injection experts, and they can watch it. They can do the course, online course, and
Okay. So Erica, get in touch with us. Write us an email.
Yes.
And when you find the right doctor, Estefania will send the video over how to do it.
Okay. Yeah, that's definitely something I worry about because I feel like in Colorado, there's no one that really comes to mind as being like a good enough person to go to.
You always can come to Germany. So if you could travel to Europe at one point, then do a quick stop at Düsseldorf.
Okay. Yeah, maybe I'll do that instead.
Great. Okay. So nice to see you. Happy weekend.
You too. Thank you.
Bye-bye.
Bye.
So everyone is coming to Germany. It's great.
Yeah. If everybody comes to Germany, it would be so nice. Wouldn't this be so nice?
Yes.
Lauren is next.
Lauren. Now we have Lauren. Hi.
How are you?
Good. How are you?
Good. I'm Lauren. I'm from Canada, Toronto.
Oh, I love Toronto. It's beautiful.
Amazing city. It's beautiful here today. I'm 30 years old and I got Botox for the first time like in my forehead because I noticed a line here that just was not going away.
Yeah.
So I did that just to kind of get rid of it. I never believed in it before and I didn't want to start doing it, but then I thought, you know what, it might help.
No, that's fine. You know, I can see your face structure. I can see that this is a good idea to put some Botox there. Yeah, I agree.
I have very strong muscles here.
Yeah. Good.
Yeah, so I did there. And then I just noticed a line like here, but I know you said don't touch anywhere.
But that's loss of tissue. What you want to do there is eventually get a little filler, you know, and not Botox won't help that, you know. There's probably where you just need a tiny little bit of filler it's like a little bit of a dark line, right?
Yeah.
Yeah, very gently. Yes, this is just to lift the skin, the level a little higher so that the darkness disappears, and you can even out the level of the skin there. It's very easy to do.
Mm-hmm. And if I continue to use like the anti-aging serum, does that help with it?
Not with necessarily with the skin. It doesn't create really a lot of tissue to do that. You know, the skin, the super anti-aging serum definitely contains moisture, and the hyaluronic acid binds also water. I mean, how long have you been doing the hyaluronic serum or the super anti-aging serum?
Oh, I've been using it now for like 4 months, 5 months.
Amazing.
I love your serums. I'm addicted.
Yeah, amazing. So, you know, what I would do is definitely continue doing the hydration. Also, the eye cream. Try the eye cream because it helps with dark circles as well. But it won't fill in those lines. So if you feel like at one point it bothers you so much, I think it's nice to just a drop. You know, you don't need much there. It's just a very, very little part, a little section there. And just can lift the skin niveau a little bit.
And does Botox or fillers help with melasma at all, or no? That's totally
no. Melasma is something coming from the sun and from the pigment, and melanin obviously gets produced more when you're in the sun. So sun is one of the problems there. And if you do have hormonal disbalances, or if for instance you have used something which damages your skin barrier function, like retinol or something in your skincare, and then you expose your skin to the sun, this can happen easily through that. So you always have to make sure your skin barrier is very strong. But what I would recommend for you to use for melasma is our Brightening Line, the Brightening Serum, the Brightening Face Cream, and maybe the cleanser and the Enzyme cleanser from the darker skin tone line in combination. Also use the Brightening Food. This is like, and always the sun drops, yeah?
Yeah, for sure.
Using the sun drops, and don't do like, invasive treatments for that, because it can make it worse,
Yeah. And I don't want to use Botox too much, but does it have long-term negative effects? Like if you do it like every now and then?
That's what I just said, you know. If I would go back, I wouldn't do that much with 30 as I did, because you know, whatever you do, you experiment with yourself. It's just always the case. But with you here, for sure, do it. Don't touch your forehead too early. Really, only the frown line. Try to really stay away from Botox as much as you can. Only if you need it, then it's a really great tool to help, you know. So, but I wouldn't do it out of prevention. I would really do it, you know,
just
when
if you see it.
Yeah, no. But for you now, I would really continue doing this. Also, what's so great about Botox, you know, for me, I never use my frown lines. I really never look angry, you know, and you forget those movements, which is also nice. So at one point you might want to test without Botox if it maybe changed your habit a little bit, and then you don't need to use it that much, and you maybe do Botox only once a year, or, you know, every second year. Sometimes this happens as well, you know. We're just like, you know, working in this business, we were just became too crazy with it, you know. And but you know, the way I inject Botox, you know, I can't look angry, but I still can move, so it looks very natural. Still, it atrophies the muscles, and I'm sure you know, I don't want to mention all my flaws right now I'm seeing in my face, so but I definitely see some signs that come from overusing Botox too early.
Right. Okay. Awesome. Thank you so much. It was nice speaking with you.
Nice to meet you.
Thanks.
Bye.
Bye.
Bye. Bye.
That's actually the last person.
So,
20 minutes over.
Estefania, one more question. So, because I honestly, when I started injecting Botox, we all went a little crazy on it, and there were different times. Now I really want to, I feel like I'm slowing down more and more. I'm also not too, I don't feel too vain anymore. I think when you get older, it's not like, oh, you have like imperfections. I think when you're younger, you're way more self-conscious. When you're older, thanks God, you just get totally relaxed about it, you know. And okay, and so what do you think, Estefania? I know you're teaching doctors, and this is like such a big growing business, Botox and fillers, but I want to really engage with everyone and say, be super, super careful. Don't try to change your whole physiology. Don't try to change your face. Try to stay away from it as much as possible. There's so many great things out there in skincare and, you know, little gadgets and stuff we can use to really prevent from doing too much stuff. What do you think?
Yes, I agree. I think the beauty is in the detail, and you can reach a good face, your face, not another new face, but your face getting a little bit better with micro optimization, with a good moisturizing, with a good day life habit. So I mean, having a healthy lifestyle. And of course we all have some little bit of wrinkles and so on, but this is not so, the tendency is to get a little bit more natural, and this is super.
Yeah.
So this is what we try to teach, that we can put just the half of a botulinum toxin and look also super nice. And this has to be discussed with the patient. So I'm super happy that you have the same philosophy that we have. It's
cool.
Great.
So one more guest, Amber. Hi, Amber.
Hi, Dr. Sturm. I am Amber from Seattle, and I spoke with you actually on the last inflammation call with Dr. Max, which I love.
Oh, cool.
Good to see you again. So in this vein of wanting to be more natural, do you feel that PRP injections, like subcutaneously for filler and in frown lines, like the 11s, do you feel like that's a good alternative to Botox? And if so, do we have to worry about it migrating, like in the cheek area, like fillers do?
First of all, I invented it, so
Right.
I think I think it's a good idea. Definitely, you know, these blood facials or blood injections, even together in combination with the hyaluronic acid. You know, I do this a lot. I mix the hyaluronic acid with the proteins from the blood from the patient. And first of all, these results last way longer. Second of all, it brings growth factors into the skin. It brings anti-inflammatory proteins into the skin, into deeper layers. And it's just so good to come, you know, and work on the molecular level. That's why I created it, because I thought it's so stupid to only do hyaluronic acid, wait until it's gone and re-inject it. We want to do something more effective on a cellular level. That's why I did it. And definitely, if you have the chance to do, PRP is not anti-inflammatory, it's more only the growth factors, but nevertheless, it's really good to bring them back into your skin. And you can ask your doctor to mix it with the hyaluronic acid and inject it as one. So, because if you only inject the blood, it won't give you any volume or stability, you know? It would just, it's still great because it really enhances the collagen, and it also gives you like this little boost. And it's really great to also enhance the matrix where the skin cells are placed. And I feel like your skin doesn't, your face doesn't really need volume anyway. So for you, I think just a blood facial is really a great way to keep your skin young, you know? But I totally think instead of Botox, yes, whatever you can do to avoid Botox, I think you should do, yeah.
Excellent. I love it. Thank you.
Good to see you again.
Good to see you too. Please come to Seattle sometime. Would love to.
I've been to Seattle. I did like a Nordstrom, like something with Nordstrom. I did like a convention thing there. And I stayed, which hotel did I stay? The Four Seasons or something?
Oh, the Four Seasons on the waterfront there, where you see the Ferris wheel at the window.
Yes.
Oh,
yes.
It's my favorite hotel. Please come back. We would love to have you again.
Yeah, it was cool. And I thought, you know, I hopped over from Los Angeles, and, you know, and this was still the time where I traveled so much. And I really didn't want to go. I really did not want to go. I didn't want to leave here. I was so exhausted. And I jumped on the plane, and it was not a short flight. It was not so short. You think, oh, it's right there. It's not. It was like 3 hours something.
3 hours.
Oh, I remember this flight. I was so bummed, and I really enjoyed it though, Seattle. I really liked the people a lot. It was really nice.
Well, we love your skincare here, so please come back.
Thank you so much. Nice to see you again.
Nice
Happy weekend.
Thank you.
Hi. Estefania, thank you so much for doing this with me today. You're such a pro and expert, and I'm really happy to have you in the clinic. Everyone out there, if you come to Düsseldorf or just plan a trip to Düsseldorf, we are happy to see you. I will be back at one point myself, and meanwhile, take really good care of your skin, and let's do anti-inflammatory lifestyle as much as we can. And yeah.
Thank you super much. Thank you for the invitation, and it was.
Yeah, I miss you, Estefania. I miss you. I haven't seen you forever.
So hope to see you soon.
Yes. Give a kiss to your family, to the baby, and a kiss to everyone out there. Bye, everybody.